Hello, everybody. Welcome once again to the English Hub with Mr. Hudson. Today, we're going to look at medicine as well as hospital and hospital equipment. So, we have in our midst a student who is studying medicine at the University of Andes. He goes by the name Diego Andres. Hello, Mr. Diego.
Hi Hudson, how are you?
Yeah, I'm pretty well. Can you please go ahead and introduce yourself?
Yeah, fine. Hello, I'm Diego Andres Bolivar. I am a second semester student of Los Andes University in Bogota, and I am pretty happy to be here tonight.
Great. All right. So we're gonna start with a conversation. The first question is, can you name some different departments in the hospital and describe what they do exactly?
Yeah, with this question, you're talking about like specializations in the medicine or like the people who works in the hospital in general?
I mean, like the different departments. Yeah.
Yeah, like okay, like the cardiologist.
Yeah. Exactly.
Okay, the medical specializations are a lot. That depends on what part of the body they focus on. Like how I say, the cardiologists are the persons who take care of the heart and all the cardiovascular system. There are the surgeons that are a different specialization. A cardiologist, of course, can be a surgeon, but it depends on what the person studies. So yeah, there are, of course, the nurses that helps a lot to the medical equip team,
Yeah. With a medical
and
team.
yes,
Okay. So who works in the hospital and what are their duties, in support of the different departments? Who works in the hospital?
yeah, the doctors
Hmm.
are the primary. Like when you get in the hospital, you first have to go and see a general doctor that is going to take like your general symptoms, like why are you in the hospital, and if they need it, he's going to call for a specialist on what you need. So there is where a specialized medic is going to look at you.
Okay. All right. And within the hospital space, there are a lot of people with different functions and all of that. Um, People come there for different reasons. So the next question is, what are the most common types of accidents in the workplace with regards to the hospital? What are some of the accidents that people can find themselves involved with?
Yeah, in here in Colombia, there are a lot of people that go to the hospital because of an automobilistic accident.
Hmm.
Uh, they are like in the motorcycles or something like that. You can see in the streets that they don't wear helmets or security equipment. So in the hospitals you can have a lot of
Motor
motors.
accidents.
Yeah,
Okay. And how can one prevent needle stick?
yeah, that's one rule in all the medicine, I think, that you have to have all your equipment in your visual like camp. I don't know how to
Hmm.
say it. So if you are using a needle or a scalpel, you have to use it in your visual camp. If you have it out of your visual camp, you can cut yourself or cut others or needle stick.
Okay,
Yeah.
can you enlighten us about some of the items you can find in a first aid kit?
Yeah, in a furnace kit, you have like alcohol for an injury. You have to clean it. Uh, you have like bandage. I don't know how to say it.
Yeah,
Yeah, bandage.
bandage. Yeah.
Bandage to if it is like a small injury, you can cover it. For big injuries, you need compresses to cover it. And for you as a doctor or first aid person,
Hmm.
you need to have personal care equipment like gloves or glasses for the blood of the person to
Hmm.
take care of you too.
Okay, can you also name some of the first aid techniques?
Yeah, in first aid, two of the most important things that you have to know is first RCP. That I don't know in English if RCP too.
Yeah.
Okay, that is the reanimation cardiopulmonar. I don't know.
Okay, so
And
yeah, continue, please.
CPR
Yeah,
is
CPR.
cardiopulmonar. Okay, yeah, CPR and the Heimlich technique for the people who is getting, I don't know how to say it, atragantados.
Okay, we're gonna look at that
Can
later. Okay,
who
have you?
cannot breathe? Yeah.
Yeah, who cannot breathe? Okay, have you ever dealt with an emergency situation, taking into account that you are a medical student? Have you ever dealt with a medical situation?
Unfortunately, no. I don't have to use my knowledge yet.
Okay, okay. Can you name some of the common medical equipments you know?
Yeah. Um, um, like the equipment that all the medical staff has, like the doctors,
Mm-hmm,
are the stethoscope that some doctors wear in their neck, for the thermometer,
mm-hmm.
and sometimes they use like a reflex hammer and the coat. Yeah.
Okay, can you describe the most medical equipment you use as a student in on a frequent basis?
The coat is, I think, is the most important part to prevent you of an injury or an strange substance.
Mm-hmm.
And the university of that their primordial activity is to save you, to take care of you, and you have to wear it all the time.
Okay, so as a medical student, um, how should disposable medical equipment be taken care of? How can we take care of disposable medical equipment?
Yeah, well, one of the, I don't know, when you think about a doctor, you think of a person that has the stethoscope in their neck. That's the first thing that I read that is
Yeah.
wrong.
Mm.
You don't have to take it there. You have to put it in your wall and your jeans. I forget the name of that. Yeah, in your coat you can have it, but in your neck is not recommended. That's
Okay.
one, I think.
Okay. So, in the hospital, there are a lot of medical equipments that doctors use on patients. In a situation where um, care has to be given to these medical equipments, how what is done to these medical equipment before it is used on other patients?
Oh, uh, all the medical equipment has to be sterilized
Mhm.
before use in every patient that you're going to see, because that's one of the sources of infection most important. So it has to be clean at
Yeah.
all.
So all the equipments have to go through sterilization, yes?
Yeah.
Mm. Okay, can you name some of the different types of medical imaging?
Well, there are a lot, like tomography or endoscopy, yeah, ecography. The Some of them use radiation. Some of them use a camera, a little camera that they introduce inside of you, or some of them uses like the sound, like waves. I don't know how to say
Yeah, yeah,
waves.
like waves. Yeah.
Yeah. So it depends in what they need to see or how they need to do it.
Okay, great.
In
Okay.
Yeah.
When what safety equipment types of medical what safety equipment is used to protect radiographers?
Yeah, the radiographers, they are out first. They are out of the machine room. They're
Mhm.
not into it. So that's first. And the second is that they use like a, I don't know how to say plomo in English. In English, it's like a material, a special material that protects me very much types of radiation, so they don't get a lot of that in their body.
Okay, so I know you are a medical student. You have not started practicing yet, yeah?
Yeah.
So let's say in your little knowledge that you have, can you describe the process for seeing patients, let's say in the emergency room?
Yeah, how I said in the beginning, well, in my experience, I think it's like a passion, not like a doctor. Is the first one that when you go to a hospital,
Mm-hmm,
you first need to see like a general doctor
mm-hmm.
in some cases, and they take your temperature and your symptoms, things like that, to know, to try to know what you have.
Yeah.
So when they know what you have, they can decide if they need help with an specialist or if you need a surgery. And if one of those situations, they use it, they call someone or give you medicine. Yeah,
Mm.
something like that.
And what is the worst time to visit the hospital? The worst time
Well, in the Christmas, the
on
Christmas,
Christmas?
yeah, the people drink a lot of alcohol or things like that, and the hospitals are full those
Mm.
days.
Okay. All right. Thank you, Mister. We've come to the first session of our interview. The next part we're gonna talk about medicine. Yeah. Are you
Okay.
ready?
Yeah, sure.
Okay. So the first question about medicine has to do with um, do most people here in Colombia prefer to use traditional medicine, modern medicine, or a combination of the two?
Well, I think that the people here in Colombia first ask their grandmothers or the old persons to know if they can solve their problems on in the home.
Mm,
Well, I think the doctors are the only ones that loves to be in a hospital, so no one wants to go there. And the second one is go to the modern medicine. I think we all want to have the better services that we can have. So yeah, but we all know that the first solution that we give to our problems are asking a grandmother or something like that.
okay. All right. Do you think there are any legal drugs that should be illegal?
Well, yeah, for the when you go to a surgery, you first need to be, well, it depends, no, but in most of the surgeries you need to be asleep, so you need to get anesthesia.
Mm-hmm.
Well, a lot of medicine that is used to calm down the pain uses opioids that are is a component that is very nice to do that purpose, like calm down your pain, but it's like a drug,
Mm-hmm.
an illegal drug. I think that I'm not sure, but well, many drugs has opioids, so it can convert in a problem for the patient because they can be dependent of those opioids, and it in a bad use it can cause the death.
Mm. What of the other way around? What about illegal drugs that should be legal?
Yeah, I think the world is opening their eyes. So how can you see in most of the modern countries like the US or something like that, they're starting to open their minds to new medicine, new and natural medicine like marijuana, that in many studies has proved that it's a better solution to
Neurological.
neuro, neurological symptoms like Parkinson or things like that.
Mm,
So I think is like the traditional culture that we have that is cutting the possibilities of using those drugs.
great. Do you think that teas and natural herbs can be just as effective or more effective for treating certain illnesses than modern medicine?
Can you repeat the question? Sorry.
Yeah, there are some natural herbs around. Yeah.
Oh yeah.
Do you think natural herbs like tea can be just as effective as modern medicine?
Well, if you're talking like effectivity, I don't think so. No. I think that it's better for like secondary effects.
Mm-hmm.
Like if it is natural, it's it has a low risk to have secondary effects, like compared to the medicine. But in terms of effectivity, I don't think it
Okay.
can be compared.
All
Yeah.
right. And what type of treatment would you give to somebody who has, let's say, the flu?
Well, if it's a normal flu, I think, well, in the in this moment, I don't know a lot. But for me, and in my experience, I don't like to use medicine when it's like a normal flu or a normal headache. I prefer to support it or sleep or well, rest, because uh, the flu is a virus, so it can mutate
Hmm.
and becomes like, it can create like defense for those medicine that you're using, and in one moment you can be, that virus can become like a super virus that you cannot defeat with normal
Yeah.
medicine. So I think
Okay.
that it's better to rest.
Okay. Do you think, or here in Colombia, do you have to pay for medicine?
No, in theory, no. But if you want a good medicine, yeah, you have to
You
pay.
definitely have to pay. Okay.
Yeah.
What about other healthcare? Do you have to pay for other healthcare?
What kind of other healthcare?
Like any other healthcare, like let's say private healthcare and stuff like that.
Oh yeah, yeah, like yeah.
Okay. Do you feel uncomfortable using medicine from a foreign country as a student doctor?
No, no. I think that is not a secret that most of the foreign countries has a better technology than ours. So I think that everything down there, it is going to be safety to be used.
It's
So
gonna be
no,
safe to be used. Yes. All right.
yeah.
Now, should doctors be allowed to prescribe a lethal dose of medicine to patients who want to end their lives?
Well, I think it's like a very controversial topic,
Yeah,
because
definitely.
when you start like studying medicine is to save the person, the people.
Mhm.
So, but in some cases, what you want is that the people don't suffer. Yeah, uh, like end with this their suffer. So if the people illness don't have like a treatment and they're suffering, or uh, occasions like those, I think yeah, it's the best solution. And if they
Oh,
want it, of course.
all right, Mister. So we're coming to the end of this um, all important conversation about medicine and hospital as well as hospital equipment.
Yeah.
Um, if somebody should ask, Diego speaks a lot when it comes to English. Mr. Diego, what did you do to learn English? Or what have you been doing to improve your English? What can you say?
Well, I think that listening to English native, like series or I don't know, YouTube channels, is the best way to learn for me,
Mm,
because I don't like nothing the grammatics. So in the school, I hate the languages classes. So, for example, I don't know what an adjective or something like that is, but I know how to speak it. Yeah. So I think that the first step is to try to understand what they are talking about, like train your ears,
yeah,
and then you can start practicing
yeah,
your,
practicing.
yeah, your speaking.
Hmm.
But the first step is like getting your ears uh, very, like a lot of English conversations and music and something like
Mm.
that.
Okay, great. All right. So, I've started all these projects to help or to reach out to a lot of people around Colombia who know the language of English to continue practicing. So, Mr. Diego, what can you say about this whole project?
Oh, I think it's a very good, a very cool project because in Colombia there are not a lot of people that talk in English first, and the second one is that if you talk in English, you don't like to talk it with another Colombian because it's first funny or well, you don't take it like seriously.
Yeah.
So if you have this opportunity to talk to someone that is going to be paying attention of what mistakes you have or something like that, it's a very good way to improve your skills.
Mm. Okay. All right. Thank you, Mr. Diego, for your time, and I hope to talk to you some other time. All the best.
No, thank you.